Today we had a breakfast meeting, mainly to listen to research findings. I think it was called Adding It Up, but the impact of particular interventions on adolescent health and the general health of Ugandans in general, and the possible impacts on the economy.
And what Adding It Up is that for it looks at specific countries and some subpopulations within those countries, and it assesses the unmet need for modern contraception, as well as the need for maternal and newborn health care. And then we present different scenarios for what would happen if those needs were fully funded in the countries.
I'm happy that the research was made, and what has come out is true. You find that people who would take family planning cannot opt for all methods they feel they need.
So the findings found that there is a large number of women who have an unmet need for modern contraception. About 60% of young women who are in need of contraception because they're sexually active and want to avoid a pregnancy are not using any method at all, or are using a traditional method.
Prosicovia was a brilliant girl. She was a smart girl, an intelligent girl, a girl who did well in school. She helped her other friends so that their grades too could improve. She liked music and arts. She liked to sing and to dance. She always made sure she was among the first people in her class. But along the way, she met a boy who confused her, a boy who played around with her future, a boy who used her, a boy who ran off so fast when he realized that she was pregnant.
As members of parliament, we're going to look at it to see how we can make sure that we budget for enough money so that these commodities can be bought. Because you find that pills are available, the injections are available, but the wrong methods are not available.
Apart from us as government distributing, we also need to do a lot of sensitization alongside this method. That's another thing I picked from the research.
In addition to that, I think it's important to also think about what this means for maternal and newborn health, because it's wonderful to avoid unintended pregnancies that women are not planning for or did not want. And then the impacts that this can have on mothers and children is also really important. And so reducing the unmet need for modern contraception will mean there will be fewer women giving birth who don't want to, and there'll be fewer complications from those births.
But what I would recommend is to engage Parliament as early as possible, so that we budget as early as possible and we're not left out. Because when you come late, it becomes difficult for us to incorporate what you have brought into the budget process.
We are going to see that government meets its commitment and possibly go beyond on what it committed in the FP 2016 London Summit, where they committed to commit at least $5 million to funding reproductive health, especially family planning.
As a member of Parliament here in the Budget Committee, to follow up on that, even as the Health Committee comes to present for budget, it should be one item that I should advocate for.